What's up, guys? Titan Talk Tuesday in full effect. Most of you guys will see the Titan Medical Center in the background. Some of you guys will just see the green screen. So I'm trying to streamline it so you guys all get to see these pretty graphics in the background. But if not, you should get the link, and the link should be there. So I'm waiting for everybody to get on there. We got an awesome program coming for you guys. I'm going to share a lot of different information that's coming up. New events that we got going on that are awesome. I can't wait to share with you guys. We also have some therapies I'm going to talk about with you guys that are coming up. Expansion possibly for Titan Medical Center coming up. So if we're coming to a maybe a state or city near you, you guys should be excited. We're definitely going to be picking out some different locations here, hopefully, that we're going to be able to service you guys. So what up, Neil? Titan Strong, baby. You know how it goes. Rachel, what's up? Dawn, how you doing? What's up, RJ? Wow, Michael Brown, how you doing? Tony Jams, my man, how you doing, guys? Thank you guys for joining in. I'm just going to wait one more minute. Hey, what up, Craig? How you doing, brother? I hope all's well. I hope those therapies are going good, dude. Yeah, man, so I wanted to basically just, start off by thanking everybody for supporting Titan Medical Center. And I'm just going to zoom out just a little bit. Sorry, guys. I'm adjusting my camera here while we're on air. I'm doing all the production myself, so it's pretty cool that I can do this all myself, but it can be a little troubling sometimes. What up, Terry? How you doing, guys? Yeah, all right. So I'll start with a question, then we'll get into it. What's BPC 157 used for? So BPC 157, and I was going to talk about this anyway. So you kind of advanced the question, I guess, in the beginning of the show. So BPC 157 is a healing peptide that's prescribed here at Titan Medical Center. What it's good for? It's good for healing muscles, tendons, joints. It brings the blood to the areas and helps heal those areas. It's more natural and per se. It comes from the juices in the gastro tract, so it's going to help. Ulcers is good for too. There's some studies on it as well. So there's a lot of good things out there that are more natural, and you should be able to take these different steps before you have to go possibly do surgery. We have some orthopedic surgeons that are actually doing these therapies themselves because they don't want to go through surgery themselves, right? Because they can't be down. They can't, stop working. What's up, Art? How you doing, man? What up? How you doing, Tim? Melissa, what's up? So yeah, so BPC is really, really good. And, I was kind of skeptical about BPC 157, but in the long run, I had a bad injury when we first started to get it prescribed. And I could barely push 25 pounds. I literally documented my video. I was really hurt. I was wondering, if I was going to need surgery at that point in time. So I used a BPC 157. We did it. We have a couple different protocols here, with the doctors and everything, and it worked pretty well. I would say within 4 to 6 weeks, I was about 75–80% to back to where I was, and finally, I'm very back, right where I need to be. I'm lifting the exact same weight. I'm going up, so there's no problems. I don't have pains. I used to be able to toss and turn at night because of the shoulders that were hurting me so bad. And I know a lot of people deal with that stuff every day. What up, Danette? How you doing? Greg, I know you loving the therapy. Awesome, dude. Yeah, so BPC 157 is a really, really good therapy. It's a healing peptide. It's prescribed here. Oops, sorry about that. It's prescribed here, and it goes well with TB500. That's thymosin beta-4. That's another healing peptide, and they work synergistically together. That one works systematically. It works all the way through the body. So at that point, the BPC is usually injected closer to the wound or the hurt site, right? It's also used in wound healing. So at that point, people that are going through surgeries and stuff like that, these things can help expedite those processes. I have an IFBB Pro legend, Dennis James, who uses our BPC 157, and he loved it. So at that point, it helped him with the shoulder injury. Now he's got a wrist injury. He just broke his wrist. So now he's going to have to go through that. But he recovered so fast with using these healing peptides. I was just on the phone with him yesterday, and he was telling me, he was like, man, it healed so good. I was back to where I was at, and then I just had this freak accident. So we're going to try to help him out in this way, get his wrist right, get him feeling good. So I'm glad. So BBC is usually, and TB is usually sub-Q. There are some oral versions out there as well. So I hope that answers your question. What up, Jay? How you doing? Jay Jacobs, that's my man. He's been taking all my amazing photography lately. Big ups to him. Thank you. I appreciate it. We got a lot of big things in store for you. I know I've been telling you this stuff. So let's get on with it. Events. I always like to get the events out there, let you guys know what we're doing in the community, what we're doing, statewide, nationwide, because we are doing things all over the country, and especially local here in our community. The first thing that we're due is we're going to hit the crunches this week. We'll be hitting some different crunches, giving away some awesome Titan gear to all you people, informing some people about the different therapies and kind of what we do and how we can help them. Also, if you guys want, give your information. We can have somebody from the office contact you. If you guys don't know what we do hormone replacement therapy, bioidentical, medical weight loss, vitamin amino acid injectable therapies, and some of these therapies are game changers, and a lot of different places don't have these therapies, and you guys can use these therapies and really, really benefit from those. Rejuvenation detox, like glutathione and stuff like that, can help you out. Free radicals in the body, get rid of them. Oxidation, get rid of it from the body, make sure you guys are healthy, right? We do a lot of different things. Hair health capsules for females and males losing the hair, thinning, possibly from androgens. This happens a lot, guys. Females and males both thin a lot from androgens, anabolics especially. So, when you guys are taking these things, you guys got to combat these things in different ways. Your body will be off balance and try to compensate, and different things and problems can happen and occur. This is why you want to be preventative about what's going on. Blood work is key, guys. We do blood work nationwide, and we test for a lot of different things. Yes, we have the full panels, which cover a majority of the different things, like hormones, like free and total testosterone, estrogen, progesterone, growth hormone, liver, kidneys, prostate as a male, full thyroid. For a female, we can test a lot of different things too. Plus a male, prolactin levels. Females, total estrogens. Different things for different people, right? So we want to make sure, because medicine should be customized to you, and it should not be a cookie cutter type deal. So I hope that that brings you guys in tune to what's going on. I want to fill you guys in about what's really going on kind of medically, and how I can help you guys, get past some of the problems that you guys are having. I know a lot of people have insurance out there and want to use their insurance and stuff like that. But ask yourself, when you go in, how much time do you spend with a general practitioner? How much time do they really spend with you and listen to your problems? And, what does that benefit you at all? You're spending time, you're spending a little bit of money to go in there and not get the problem solved. A lot of general practitioners and doctors just want to turn a burn because they have to get paid and they have to get sure. They have to make sure they're getting the claims in so they get paid. So, listen, I understand totally, but it's your health we're talking about, so we want to make sure that you guys are taken care of and your problems are listened to and they get taken care of with not just putting a Band-Aid over a bleeding wound, but actually fixing that wound per se, okay? So, all right, so we got the crunches that are coming up. We have Chill Lounge Illumination. I'm really, really pumped about that one. We're doing that with Rainer. St. Pete, November 17th. We're going to have a big, big tent out there, Titanettes out there, some of the clothing out there. I will be doing a giveaway at the end of this for Titan Gear. Hashtag Titan Gear at the end of this. You guys will be texting the main line. And hashtag Titan Gift, which you guys can put towards blood work, services, clothing, whatever you want that we do at Titan, you guys will be able to do that right there. So that'll be really, really cool. So we're doing illumination with that. So it's a huge, huge event. Really, really upscale. A lot of different shows going on, fashion shows and such. It'll be all lit up, really, really cool. So join us out there November 17th, Illumination. Cars and Couture. That's another thing with exotic cars. Donna puts that on. She's awesome. Great events. We love working with her. We're going to be out there. Titan Vet will be out there. It'll be really, really cool. We love talking to people, interacting with our patients and new patients, hopefully. Another thing is the Celebration of Women. So our good friend is putting that on. We are a sponsor. It'll be in St. Pete. It's coming up very, very soon. So they're going to be auctioning off some of the women for charity, and not in a bad way, guys, in a good way. These girls are very, very upscale, high echelon women, and it's going to be awesome, guys. So come out and join us for that too. So enough with the events, enough with all the talk. Let's get into some of the questions, and I'll get into some of the therapies we're talking about. And I'll save that question for last. But the second question I should answer is, John, when I get a blood test done, what should I look for? What should I ask a general practitioner to do with that blood test? Well, guys, you guys got to know your numbers and what they are. And a lot of different blood tests can mean a lot of different things. So kind of hone in on what you are worried about, and don't focus on all these little different tests that have no really bearing on what's going on with you guys. Really focusing on the things that are going to help you, and make sure that you guys are leading to the source of the problem and not just fixing a little issue that is going on and letting that problem get worse and worse and worse. And one is testosterone levels for males and females. Guys, I stress the blood testing. Please do the blood testing. Make sure, if not with me, with somebody else, make sure they're treating you right. Make sure you're getting the right medications. Make sure you see a medical professional that is going over these blood tests with you, going over all the medications that you're going to be taking because you're putting them in your body. And a lot of these things that we do are sterile, and other places that do are sterile. That means you're injecting them in your body. Guys, you guys want the best for your body. It's all about that, and when you make sure that the person that's prescribing that is certified and licensed to do that. So guys, if you guys aren't seeing somebody that's licensed and somebody that's just saying, take this, and this, your blood means this, guys, run real fast, okay? So I want you guys to be protected on that, all right? So therapy of the week. Therapy of the week is Titan Complete. We get a lot of questions about Titan Complete. What is Titan Complete good for, and what is in Titan Complete? So Titan Complete is a vitamin injectable with amino acids as well. So what does it have in it? It has MIC, which is great for metabolizing fat and weight loss. We also have L-carnitine in it. We have B-complex, B12, and all 3 branched chain amino acids, which are essential amino acids. And essential amino acids means that you have to get them from an outside source. The body does not produce them. And the biggest claim to fame is you'll get it from your nutrition. Guys, nutrition is awesome. If you can get that on point every time, and you're making sure you're getting everything in abundance for your body and what it needs, God bless. For me, I'm real busy. I'm always on the go. I try to eat as best I can. I try to get it all from nutrition. I don't drink any really protein powders or anything like that. So I'm a big believer in that from food. But I know that I'm not getting everything I need through the day. And that's why I'm supplementing in these medical doctor-prescribed therapies to help me live optimal and get optimal quality health, basically. I want to, perform at optimal levels all day. We've got this clinic running. We're going to be franchising soon. Yes, you heard it first. We're going to be franchising. If you want us to come to your state, there's a contact form that's going to be on the website. You guys can contact us there. A little bit about that later. But, so, Titan Complete. MIC, B-complex, B12, all 3 branched chain amino acids, L-carnitine, great for energy, great for boosting the natural metabolism, great for weight loss, all a good vitamin amino acid injectable therapy that combines a lot of ingredients, guys. Look about what you're getting ingredients. Compare apples to apples of what's on and what's in the bottle. That's what it's all about, okay? I want to make sure you guys are loud and clear about that. I see these super B12 shots. People go raving about it, like B12 or L-carnitine all by itself. Why would you inject just that one little ingredient when you can get all the rest of those ingredients with the same injection, guys, okay? So I'll answer one more question here, and then I'll go back to what we were talking about. Scenario: just turned 40, former NCAA basketball athlete, have a big belly and need to lose 25 pounds. What do you recommend? Okay, so you're 40 years old. So my first question to you is, have you had a blood test, and do you know what those hormone levels are? The reason I ask this is because you are a former athlete, right? So I know you were probably in pretty good shape, obviously. Now, with the big belly, usually that's a red flag when you see that out, guys. I can see in public, and literally, like, once you see like hormone deficiencies and blood tests and kind of see what the example is all the time, you can kind of see it, and it stands out, right? So when you see a guy walking by, usually when they're holding belly fat in those areas, it's usually low testosterone, bad diet. There's a lot of different things that can point it out, but that would be the first thing. And you're 40 years old. So we know, from 30, you're going to go down 1% every year. Different people fall different every year, right? They decline at different rates. Plus, these people start out at different numbers. So you don't know where your number's at and where it's going to be. And those numbers are big. And I always talk about know your numbers, right? So total testosterone level, 246 to 916 is the lab court reference range. That means if you're anywhere in between that reference range, you're normal as a male. Do you feel normal? Is your energy good? How's your concentration? How's the recovery? Is the libido good? Do you still have that drive and motivation you used to have? No, probably if you're on the lower end, but you're still normal. You're in the normal range. That's what you guys will get told about 80% of the time from general practitioners. That is what is treatable, okay, for us, possibly, and untreatable for them. So at that point, know somebody that is not restricted by insurance companies or anything else and can help treat you as the patient, not just the numbers on the LabCorp reference range. And that's where a lot of general practitioners go back to. They don't care what's written down or what you've said to them. They look at the lab and they say, well, he's normal. Got to go on your way. We'll give you this, this, and this, though. Come on, that's not right. So I would start with the blood test. Make sure everything's good there. If the blood's off, you need some, some changes, to make sure you're running at optimal levels or healthy levels, then that's what you may have to do. Otherwise, if the normal levels come back and you're within higher range, right, then might want to do some vitamin amino acid injectables, some ECA Stack Plus. So those are really, really good for weight loss, guys. It's an old school trick. It's been around forever. It's not over the counter anymore. It's ephedrine HCl, caffeine, aspirin, B12, and chromium. And with this combination in oral capsule, you're going to get great, great results with energy, weight loss, fat mobilizing and your metabolism boosting. So at that point, you're going to get a lot of bang for your buck in that. It's going to be oral, so you want to do an injection. And you're not going to get any of the crazy other ingredients that you might get from an over-the-counter fat burner. You're not going to get heart palpitations, jitters, shakiness, not be able to think. I mean, if you've taken some of those things, you know what I'm talking about, and you never want to experience those things again and actually get scared when somebody says fat burner. Guys, a real fat burner, a prescribed fat burner, shouldn't make you feel like that. You guys should feel good, clean energy, concentration's great, and ready to move and ready to get that weight loss going, right? So that is what I would say. I can't recommend because I'm not a doctor, but that's what I would do, and we can definitely help you out with some of those options. Titan Complete's gave him great energy. Greg, I am glad about that. No blood work yet. Definitely need blood work, man. 40 years old. Definitely. Sorry, guys. I'm just waving to everybody. What up, Terry? How you doing? We got some people on here. Chenille's on here. Our great ARMP. That's our registered nurse practitioner. Guys, so if you don't know, we have a 4,200 square foot office here in Tampa as our headquarters. We have two medical doctors on staff, a nurse practitioner on staff. So at that point, we've got a great medical staff and medical assistants and everything back there too, calling on our patients, making sure you guys are taken care of. So we talked about the therapies of Titan Complete. Winner of BBC 157, that was kind of earlier. I was going to cover that later on. And TB 500, thymosin beta 4, and how they work synergistically together to help you heal and get you good, great healing results. Whether it be wound heal or joint or tendon, it can definitely help. It's definitely helped me, and it helps a lot of different patients, guys. So that one's a great one. Those therapies working together, or BBC alone. I like that one a little bit better than the TB 500 myself. It worked a little bit better in those ways of healing me, I think, and that's the only one I did use in the beginning. I didn't have the luxury of having both of them at the same time, like our patients have now, right? MK677. I'm still getting a lot of questions about MK677. One of my athletes came in, Rodney Fillon. If you guys don't know who he is, Rodzilla. The guy is just a specimen. He's older. He's just in great shape. But he asked about the MK677. John, what is this? How does it work? Do you think it'll benefit with me as a therapy? And we have to ask some questions here, like, what was your IGF-1 level? Did it come back as? Was it high? Was it low? It's got some great benefits as far as raising the IGF-1 levels. We have heard some, minor issues of some water retention, but that going away. Obviously, it's going to increase hunger. It's a hunger hormone. Growth hormone releasing hormone is what GHRH stands for. So at that point, a lot of people have some results of great strength. IGF-1 levels have came up in blood tests from patients. So that's always a winner. I always like to see blood testing because blood is the proof. You can't mess with blood. So you pull blood and you see exactly what's going on in the patient. From the outside or placebo effect to how they feel, it's a whole different story. Mix that with blood and put the whole picture together, and then you will see the result of what it really is. So that's really, really cool. MK677, it's an oral GHRH, growth hormone releasing hormone, and we do have a prescribed therapy here. You should do a Q&A on IG. I am doing a Q&A on IG, ain't I? So, I basically will answer any questions you guys want out here. I always do it every Tuesday, Titan Talk Tuesday, 6 p.m., yours truly, John, I will have special guests. So our new doctor, Dr. Byrne, I'm going to have him on here maybe in a couple weeks, answer maybe some of your questions, go over some of the cool therapies, give his perspective on our therapies. Every doctor we bring in here, they've never seen some of these therapies before. You know, they usually work within general practice or hospital rounds or whatever the practice is, internal medicine. But when they come in here and they see preventative medicine, preventative is, so before it breaks down, you fix it. I always go back to a car because a car is a very easy example that everybody understands. And the example is that you do preventative work for your car. You give it oil changes, you rotate the tires, you make sure everything's working properly because you want it to work properly and in good shape so it takes you places, right? That's the same thing about your body. But your body should be more of a priority to you than anything else because your body's going to get you essentially where you need to go every day. And that's really what it's about, guys. It's about getting where you need to go every day, doing the best you can with that body, with that temple, with that vehicle you have. So the preventative measures are like glutathione, lowering liver functions, super antioxidant that's going to help people daily, getting rid of your free radicals, okay? These are big therapies that a lot of general practitioners don't even talk about. They want to talk about other medications that have all more negative side effects on you, that produce more health problems. And guys, if you're a business owner, we do corporate wellness programs, and we're going to start opening them up all around the country as far as coming in, doing an assessment on your employees, helping your employees get to optimal healthy levels, because we know that if they're healthy while you are working a job, you're going to be more productive and you're going to get better results. And that's going to help you, that's going to help the company, and overall benefit everybody. And that's what it's all about, like I said. I want to debunk some myths here. So, myths about testosterone. So, myths about testosterone is that roid rage. Testosterone creates roid rage. Guys, we know testosterone raises testosterone levels. We know that we have testosterone, males and females, right? We know that testosterone levels can go high. We do know that testosterone aromatizes into estrogen or DHT, which dehydrates testosterone. Now, estrogen levels going real high, especially in a male, is going to create him to be irritable, have water retention. You could possibly get gynecomastia. I mean, there's a lot of different things. Fat deposits over the body. So that's the really thing. His hormones are out of whack. And at that point, he's getting very irritable, short-fused, and having that roid rage. And that's coming from an imbalance of hormones, which is a lot of different things out there with chemical imbalances that they say and prescribing different drugs for that are really hormone imbalances and could possibly be fixed. So think about it, guys. It makes sense, right? I just wanted to go over some of that with you guys. What's up, Denise? How you doing? Man, it's really cool to see you guys. Vince McGinnis, what's up? How you doing? Why do you use sublingual testosterone for women versus injections? Okay, so this is a question that does come up a lot of time because there are some doctors out there prescribing injectable testosterone. And cream is just, the different absorbency, possibly getting on other people, and not going in and being effective is why we usually don't do creams. But sublingual is what we usually do. The reason we do sublingual is injection, first off, if you try to dose an injection from a 200 milligram per ml cypionate per se, it's going to be very hard. Let's say her dosage is 2 milligrams. To put that on a syringe and inject it, even with an insulin syringe, it's going to be very difficult. The second thing is it's high absorbency and fast acting. That means it's going to spike her levels. Now, if you get the dose right, it could work out. I'm not saying it wouldn't work out, because it would. And our doctors they went over it and thought about it. It's a possibility for some patients. That's why we say everybody's different, right? But at that point, it does spike those levels, and those levels get up too high, and possibly negative side effects like facial hair or hair growth all over the body, clitoral enlargement, deepening of the voice. These problems can happen to women. And guys are a lot easier when it comes to hormones. When it comes to females, it's a lot harder, and they do, they do have more complaints. I hate to say it, but they have more things that could possibly go wrong. And if they're bloated or water retention or any of these other side effects happen that could possibly be non-reversible, then we don't want to be liable. We don't want that to happen to our patients. So with the dosing of that as well, the sublingual troche, the doctors can tweak that dosage per day if they wanted to. If they said that wasn't enough and we blood tested and they need to increase it, or lower it, they can do it automatically, and it's not in their system. That's the reason we don't do pellets either. It's because once they're in, they're in. It's hard to correct, especially on a female. So you want to make sure that these levels are right and you're dosing and tweaking right. So that's why we use the sublingual in first injection. I'm not saying that the practitioners and medical director are 100% against injections for women, but I would say the first try would probably be sublingual is what they're going to do. What's up, guys? Nice to see you. Nice to see you. I was just debugging a myth about testosterone. Is testosterone therapy lifelong? This is another good question, guys. Is testosterone therapy lifelong? So testosterone replacement therapy is just that. It's replacing testosterone. It's replacing the testosterone that your body is not producing and does not have in it. So at that point, you're going to have to replace the testosterone. Otherwise, if you take the testosterone away, you're not going to be replacing it, and it's going to go down, right? It's going to go down back to where it was, or possibly a little bit lower. And we know that over time, it's going to keep going down. So eventually, you're going to have to keep replacing it. So it's not a lifelong thing, per se. It's not a life or death type deal, but maybe feeling the best you can and everything might go away. So if you want that feeling and you want that result, then you're going to have to replace the testosterone to make sure you're getting back to those optimal levels. And at that point, you got to make sure you're healthy. You got to make sure everything else is good. And at that point, you know, you're going to get the optimal results and you're going to feel good. Big biceps. Not yet. I'm not big. I'm actually leaning up, guys. Trying to be as lean as possible. That's what it's all about. Lean quality mass. I always say don't chase that weight on the scale, guys. Especially guys. I see a lot of the young guys that want to get big, like, man, I want to get 225. It's not about that. It's about lean quality mass. It's about being healthy, low body fat percentage, being getting out there, being active, being able to tie your shoe without, taking or losing breath, right? I've seen some guys huffing and puffing. I used to when I was real big. I definitely feel a lot better like this. I feel more active, more live, more energy. So, I hope that's answered a lot of your questions, guys. I've been wanted to end Titan Talk Tuesday on a good note, and that definitely is. Guys, if you guys have any questions, concerns, please call or text us, 727-389-3220. Remember, we do nationwide, bioidentical, hormones, males, females, blood testing, nationwide. We'll set you guys up, cheapest prices, apples to apples testing, custom vitamin amino acid injectable therapies like Hercules Potion, Titan Complete, Nectar of the Gods, Titan Ultra, Titan Serenity. Guys, we have so many different things. ECA Stack Plus for weight loss. We have our fat burning cream that a lot of women and males use. Guys, we have so many therapies that we can help you out with. Please, just give us a call or text. Also, check out our YouTube. All our instruction videos on how to do the injections are on there. Plus a lot of cool content about our therapies and who we are and what we do. Social media, Instagram, Facebook, keep it locked. Every Titan Talk, Tuesday, 6 p.m. Eastern Standard Time. Guys, remember too, we're franchising. If you guys know people or have doctors or anybody that are interested, please check out the website. Have them call or text us, 727-389-3220, and I'll set you up with a finder's fee. Guys, I'm John from Titan, and we're out.